Somebody lied to you about aging. They told you it was something that happened to you. Nobody told you it was something that you could lead. Now, I want to tell you about a man I sat with a few years ago. He had done everything right. 30 years of savings, a paid off home, a solid retirement plan that his financial advisor was proud of. His wife of 41 years had slowly developed dementia, and he sat across from me. This man who had built everything he was supposed to build. And he looked me in my eye and he said something to me I have never once forgotten. He said, "Sean, I planned for everything. I just didn't plan for this." Now, I've sat with hundreds of families at that table. And I can tell you that the moment is almost never, ever about money. It's about everything that came before the money. Everything that either protected the brain or didn't protect it. And that's what this channel is built on. And that is what we're going to talk about right here tonight. Now, here's what nobody in the retirement industry is going to say out loud. Loneliness has been normalized in America. We built an entire culture around it. Streaming services that keep you home. Social media that stimulates connection without delivering it. A retirement industry that sells you funds, annuities, and estate plans. And they never once ask you, who are you going home to? The villain tonight is not a pill. The villain is a system that profits from your isolation while your brain quietly pays the price. And that price is higher than anyone ever told you. If you found this channel, you already know something most people haven't figured out yet. You're not here to slow down. You're not here to disappear. You are here because you refuse to let aging happen to you. See, the industry never respected us. We are just customers to them. We're numbers on a spreadsheet to them. But right here, we're building a nation. And in this nation, the citizens get the truth. And the truth your brain needs tonight is one that nobody in the retirement industry has ever had an incentive to tell you. Now, my co-host, Bridget Smith, she is also a certified dementia care trainer. And in every episode going forward, she's going to sit right here and tell you what she sees when the door closes. But here's what I learned from almost 20 years in healthcare and over 9 years on home care. The families who struggle the most are almost never the ones who run out of money first. They're the ones who ran out of connection long before the diagnosis came. That's not a feeling. That is a pattern I've watched repeat in home after home after home. Before we go any further, I want to say the Whealthy Nation is brought to you by A Touch of Love Home Care. A Touch of Love is the Connecticut home care agency that Bridget and I built together from the ground up. We have spent over 9 years walking into homes at the hardest moments families face. We built this channel because of what we witnessed there. If you or someone you love is living those conversations right now, A Touch of Love is in the link below. Now, citizens, here's what your brain needs to know this week. I want to give you one image to hold on to tonight. I want you to think about your brain like a city. In every real conversation that you have, every shared meal, every genuine laugh, every moment of true human connection builds a new road in that city. And more roads mean more ways to get across town, more detours when one road closes. Scientists call this cognitive reserve, your brain's backup system. And here's the part that nobody is telling you. An isolated brain has fewer roads, which means damage shows up sooner, which means the man I told you about at the start of this episode, the one who planned for everything, his wife's brain was losing roads years before anyone saw the first sign. The 2024 Lancet Commission, the most comprehensive dementia research published in the world, found that up to 45% of all dementia cases are linked to factors we can actually change. 45% factors we can change, not genetics, not bad luck, factors we can change. And isolation is on that list. Now, a researcher named Dr. Julianne Holt-Lunstad spent decades studying what loneliness actually does to your body. Now, in a study of over 300,000 people, she found that the health impact of loneliness is equal to smoking 15 cigarettes a day. 15 cigarettes. Now, if someone you love smoked 15 cigarettes a day, would you worry about them? Would you say something? If they were profoundly isolated, you might not even notice. One is treated as dangerous, the other is treated as normal. The biology doesn't care what you call normal, what we call normal at all. And now new research from just last year, a meta-analysis of 21 separate long-term studies covering more than 6,000 people, 6,000, found that feeling lonely raises the risk of developing dementia by 31%. Independent of depression, independent of whether you live alone or not, the feeling itself, the subjective sense that your relationships are not what they need to be, that is the risk. Right now, 1 in 4 adults over the age 65 is socially isolated. Let me say that again. I want you to really get this. 1 in 4 adults over the age of 65 is socially isolated. That's not a statistic about other people. That is someone in your neighborhood, someone in your family. Maybe, if we're being honest, sometimes you. This is not about being a social butterfly. This is not about the number of people in your life. An international research consortium just published a study that identified exactly which qualities of a relationship actually build your brain's physical reserve. 3 things. 3. Reciprocity is 1. Both people actually showing up. Number 2, dignity, feeling genuinely seen and respected. 3, emotional closeness, connection that goes beneath the surface. Beneath the surface. Not how many people you know, how real the relationships are. One real conversation where you are genuinely present does more for your brain than 100 passive scroll sessions. Connection is not a lifestyle upgrade, citizens. It is brain medicine. Now, if this is landing, I want you to hit subscribe right now. And I'm going to provide you with a free guide down in the description below. I want you to bring someone with you because this nation grows one citizen at a time. Now, I want you to do something right now while you're watching. I want you to open your phone, open your notes app, or any blank screen. And I want you to type one name, just one. The name of someone you have been meaning to call. Not text, not like their post, call. Someone you have let too much time pass with. Someone who would be genuinely glad to hear your voice. Type their name. Look at it. That name on your screen is a road your brain needs, and you have not been traveling it. Keep that name where you can see it. We're going to come back to it. Now, I want to be honest with you about what is working against you. The average lifetime cost of dementia care in America is $405,000 per person. Families cover nearly 70% of that out of pocket. The retirement industry sold you a financial plan and left out the most expensive line item. Now, a brand new national survey just found that 36% of retirees say financial stress is already affecting their health. That is not a coincidence, people. That is cortisol. Your financial life and your brain are in this together. We're going deep into that starting Sunday. And the technology that was supposed to connect us is actually doing the opposite. The algorithm is not your brain's friend. Your neighbor is. The old friend you've been meaning to call is. The person whose name is on your screen right now, they are. Now, I want to go back to the man I told you about, the one who planned for everything. After that conversation, he did something I did not expect. He started calling people, old colleagues, his brother he drifted from, a neighbor 2 doors down he had never really spoken to. And he told me later, he said he had no idea how many roads he'd stopped traveling. He couldn't undo what happened to his wife, but he could protect what was still his to protect. That's your charge this week. That name on your screen right now, call them. Not a text, not a like, a real conversation before Sunday. Because we don't age quietly. We age wealthily. Next week, Sunday, we're going to talk about the most valuable retirement asset that you own. And I promise, it's not what you think it is. And I'm going to drop new episodes every Sunday for sure. I will see you here. Citizens, take care of your brain.